Hi guys, my name is Ramanak and this is a video update of what's happening with me after I had a bimalleolar fracture in December of 2022, 23 December to be precise. And this is just an update after an year or so. So I had a pretty good recovery and I had a bimalleolar fracture. My lateral malleolus was fixed using a screw and a washer, and my medial malleolus was fixed with a tension band. So I had two pins and a screw and a wire. It didn't give me any kind of pain throughout the year, but it bothered me. So it was all psychological. So it bothered me for an year or so, and I never felt my leg like I felt it like before. I didn't had any kind of pain, but whenever I used to touch my leg, I felt there's something inside. It was not very superficial, but I felt like there is something. So in the back of my mind, always there was a thought that I have something in my leg, and this was bothering me. It was not the pain, the discomfort that was bothering me. This mere thought of having some kind of foreign object in my leg was the main reason that was bothering me. About my range of movement, I had almost regained quite a lot range of movement, but not in the front side. That's very tough. So my plantar flexion was very good, but my dorsiflexion was still affected. I was not able to move the ankle that much in that direction, but still I used to do all the works which I am usually doing. So my quality of life was not degraded anyhow. I'm not a runner. Usually I walk a lot, and after my surgery, after 4 or 5 months, I regained the confidence and my thought process so that I can walk around as usual. As I told, I was not a runner, but I tried because sometimes we have to run, and I ran a little bit 2-3 months ago, and I thought that was enough, more than enough for me. But with having that thought of having something always in my leg, it was constantly in my mind. And I was in a situation that even touching my leg, my ankle, and my feet, I thought that there is something. So it was like my leg is something very holy, so I'm not touching it anyhow. So that was my feeling. And my doctor's visit was usually every 2-3 months. Apart from the starting, it was very soon, and I had to go to the doctor's office. But after like 3 months, I had a doctor visits like every 3 months, so or every 2 months, and the doctor did their X-rays and told me that my bones are correctly in shape. So on my last appointment with the doctor on 6th of December 2023, the doctor informed that now my bones are healed completely and there is no need to visit the doctor again until I have any problem. So once the doctor told me this, I informed the doctor about my situation, about my psychology, about my leg also, that this is happening, and I requested if there is any way we can find to remove the my implants anyhow. So the doctor told me that usually these implants are forever in our body unless the patient is having some kind of problem. In my case, it was probably mostly my mental thought process behind it, and the doctor obliged and he was understanding enough, and he told me, okay, give me your details and we will call you back once we discuss with the surgeon. After coming to my home, I also discussed with family doctors about my situation, and they all informed the same thing, that until and unless the patient has issues, usually the surgery is not done again to remove the implantation, and it's very patient based. So the next day, the surgeon called me and informed me that my surgery is due, and I have to come to get the surgery done for the implants removal. And he told me that it's a day procedure and we would be probably relieved before the night. And I went there, I had my surgery done, and like last time it was anesthesia in my back and my below half was completely gone. This time they gave me local anesthesia on my ankle, and IV sedation. So I was sedated for most of my surgery. It was an experience, not like the last time, because last time I was fully awake, I was seeing the X-ray machines, whatever is going on. But this time around, I had very vivid, colorful dreams during the surgery, and once the effect of the IV sedation weared off, I slowly opened my eyes and I got out of my sleep and I saw that the green colored curtains, and I remembered, oh, I am in my surgery. So I had a very different experience from the last time, since the last time I was seeing what was going on, and this time I was gone. I was in my sleep. Only I got up in probably the last stitches I was getting. I got up at that point of time. After that, I went to the recovery room, and I was little bit dizzy at that point in time, but I was good enough for a conversation or two, little bit here and there. And then I went for my ward. I was shifted to the ward once all the vitals were still were going on fine, and I'm with my family and friends, and it was like a half an hour surgery and everything was removed. So all the implants are gone now, but the doctor still insisted me to stay the night in the hospital, and I stayed for one night in the hospital. They came back. There's one more difference, that this time they didn't do any kind of staples on the wound. They put stitches on my wound both sides, so I have stitches now. And they asked me to come back after 1 week for dressing again. So today is 15th of December 2023. I had surgery on 7th of December 2023, and I visited the OPD for orthopedics on 13th of December, and then they saw my wound. It is still healing, and they did the dressing again, and they called me after 1 week. So I have to go back again on 20th of December to remove the stitches this time. Seeing the stitches and experiencing the staples, I know what the staples feel like removing, but I still don't know how the stitches feel. So I am little bit still concerned about how my stitches are going to be removed, and will I have pain or will I don't have pain. The guys who are at the dressing told me that it will be a kind of feeling that something is being removed. I should not have any pain. I was relieved a little bit. So this is my story, and the story will go on. I will keep you informed about my process and my recovery. So this is my current situation. I am 1 week post surgery, and I am walking with a limp. I have stitches in my leg. I am walking with a limp, and my leg feels very light. I am grateful. So about the removal of the implants, if you are thinking about it, all the talk with the doctors, I concluded that it's very, very patient dependent. Sometimes the other reasons are also there, that if your implant breaks away, or if you have any kind of infection due to the implants, then only they remove. And if the implants are giving the patient some kind of issue, in my case it was only mental, and I was psychologically very involved with my implants, so I got them removed. After I removed them, I had a thought that maybe I could have collected the implants and kept it with me for rest of my life. But then I thought that it's okay that they are with them and I didn't collect it, so that I don't want any memory of those implants. The implants, they didn't give me any kind of pain or something, but it was just because they were there. I was thoughtful of them. That's it. So it's all up to you, that you want to remove your implants or you still want to have them for the rest of your life. They are made in a way that they should not be removed, but in my case I got it removed and I'm feeling very right. So if you are in my situation and thinking about getting the removal of the implants, this is the procedure here in Kuwait. I'm staying in Kuwait, and it's a little bit easier having surgery here and getting the medical attention. It must be varying with your place and location. This is my story. The story will go on, and I will keep you informed about my details whenever I have something new to inform. So thank you for your time, and I hope the best of health to all of you. And if you are in any kind of situation, I hope the best for you, and hopefully everything will be going well for all of us. Cheers. Bye bye.